The most difficult part for me as a family member was watching my daughter in so much pain and being helpless. It's like watching your loved one drowning and not being able to go out and help them. And every mother wants to, every family member, every human being wants to save people that are in pain. And I couldn't. It was her pain to go through, and I had to just stand and watch. I started noticing that my daughter was having trouble when she was like 2 weeks old, and she was a little more anxious than other babies. She was very particular about who would hold her, and she'd cry a lot when a stranger touched her. And that's not really usual with babies that are 2 weeks old, but she was like that. We just sort of thought that was her personality. We thought when she was little that she was naturally shy. So we treated her that way, and she was also very much of a perfectionist, and I realized that she was more of a perfectionist than most children are. So we tried to help her through that and make her feel at ease. Then when she got to be a teenager, she had a full psychotic break. And I was terrified, confused. I honestly did not know what was going on. It was like a nightmare. It was a horrible experience for a mother to watch a daughter change so quickly. When my daughter had her first psychotic break, we did what I did for my other family member. We visited her actually every day. We learned everything we could about her illness. We went to a support group at Stanford for family members of people with schizophrenia. I went to a NAMI, National Alliance on Mental Illness, family-to-family class, and I learned how to be a supportive family member and how to take care of myself. I still can't help but believe I could do more. I want to do more. I want the pain to be gone. I want her to be healed. It's very hard for me to come to the realization that it's her illness and I cannot walk in her shoes. I've noticed that when my daughter's not feeling well, people don't talk to me about it. It's like she becomes invisible to others. So it's like she's in the hospital. I have some friends who will call and say, "How is she doing? Is she doing better? Can we do anything? Can we bring you meals? Can we help you out?" And we've also had some people that we know that just will not talk about my daughter. Even at work, there were other teachers on my staff that would just not say anything about it. Like it was like they were afraid that if they said something bad would happen, like she had cancer and they'd get it or something. Fortunately, now there's so much more knowledge about mental illness that where I'm working, people ask me, "Is your daughter doing better?" when I come to work every day. And I think, okay, that's a change. It's not the stigma that I had before. A lot of families in the kind of a situation that we've experienced in our family get torn apart. there's a much higher incidence of divorce when you have special needs children, like we did. And I'm going to say there were some really rocky times in our marriage because we had to get it together if we were going to support our daughter. I think it's very important when people have family members, loved ones who have mental illness, that they take as much care of those loved ones that do not have mental illness as they do the ones that have the mental illness. Nobody can tell how much another person is suffering because of a diagnosis. So I think families need to be educated. They need training. They need to be listened to so that people can recover. So I've learned how to be a support group leader. I am a trainer for family-to-family classes. Family members come to my classes and learn about illness. I love to teach those classes and to watch family members learn that they're not at fault. I'm a more self-assured parent now than I was when my daughter first came down with her illness. I was so afraid that I'd do something wrong when she first became ill. But now I have a lot more confidence, and I know that I've done a lot of things right, thanks to so many people in our church, in our support group, in the NAMI groups, in the Mental Health Association, in all those groups. So many people have really encouraged me and just are constantly telling me I'm doing a good job and what I'm doing right. And I'm beginning to believe it myself.